Good afternoon.
Good afternoon.
Good afternoon, everyone.
Okay. Just let everybody in from the waiting room and we'll begin.
No, they're coming and coming, so
Yeah.
they will come constantly.
Okay. So you suggest we begin?
Yeah.
Okay. Great. So hello, everyone from the Mashav Carmel Center in beautiful Haifa. My name is Chava Kari, director of the center, and I'm here with my colleagues in Haifa, the organizers of the event, Katerina Rudenko and Anna Andrachnik and Yuda Michael. Welcome to today's expert panel on mental health and community resilience in cooperation with WHO and Enosh. Thank you, all the experts, for coming on and being with us today. We greatly appreciate it. Maintaining a positive state of well-being has been a great challenge to people from all walks of life, and especially for the most vulnerable. We are pleased to be addressing this issue today, bringing world-renowned experts to this event. I have the pleasure of introducing Ambassador Einat Schlein, the head of Mashav, Israel's International Development Agency, and the Deputy Director General of the Israeli Ministry of Foreign Affairs. Ambassador Schlein is a career diplomat specializing in the Middle East region, Israeli-Arab relations and American affairs, promoting dialogue and understanding in the region. She was recently ambassador to Jordan and has held various senior positions at the ministry, Washington, D.C., Boston, as well as many other positions. Ambassador Schlein, thank you for coming to join us this morning. We know you're super busy, and we appreciate your taking the time and coming to us from Jerusalem. The floor is yours. Thank you.
Thank you so much. It's a pleasure for me to be here today with all of you. I welcome all of the participants from all over the world. I welcome and I'm grateful for the panelists. And also I'm happy to see my colleague Mirav Elon Shachar, our ambassador in Geneva. So today we're gathered to speak of a very important issue, which importance intensified during the recent year as we were all faced with the crisis caused by COVID-19. Community resilience has many aspects and many forms. We could speak of community resilience when speaking of private issues such as mental health. We can speak of urbanization. We could think of wars and terror and famine and all sorts of issues that are reflected in the community resilience. I think it's a core issue of our society, as obviously we're able to tackle any problem much better when we do this as a group together, combining all of our efforts instead of just trying individually to find solutions to complicated problems. Mental health is a phenomenon. Problems of mental health is a phenomena that affects the life of those involved and their families, also their communities. We should put all of our efforts together and look at it in a multifaceted manner. And these are the kind of platforms that we'd like to offer in Mashav. Mashav's International Development Cooperation Agency of Israel is focused on capacity building and is trying to make every effort possible to bring in together specialists to share, to learn, to brainstorm, and to provide the platform as we're doing today to new ideas and wisdom and methodologies. So be it physical meetings or Zoom meetings as we're having today, I think that the world is dealing with a lot of similar problems in various communities. And I hope that this session today will enable all of us to gain new ideas and new insights of the way that various communities are dealing with the issue at stake. And hopefully together we could come up with creative suggestions and that could lead us to better the situation in this regard in all of our countries. So thank you very much. And I'm looking forward to an interesting seminar. Thank you.
Thank you very much, Ambassador Schlein, for taking the time to be with us today and for your words. Our session is being broadcast live on Facebook as well as to a live audience on Zoom. This is an interactive session, and so you're welcome to put your questions in the chat. And we will be recording, so if someone does not want to be seen, you can close your video. And now we have the great honor of welcoming Ambassador Meirav Elon-Shachar, coming to us from Geneva, a permanent representative to the United Nations and international organizations in Geneva. Ambassador Meirav Elon-Shachar has held many senior positions at the ministry, including Deputy Director General for Coordination and Policy Planning, Israel's ambassador to Vietnam, counselor at the Permanent Mission of Israel to the United Nations in New York, among many other positions. So, Ambassador, thank you for joining us, and the floor is yours.
Thank you very much. It's a pleasure to be here today with all of you. I don't know if to say good morning, good afternoon, good evening. I'm sure somewhere it fits, and it's thank you to Mashav, and it's also great to see you, Einat and Chava, and thank you to Merkaz Carmel for organizing today's event. As we all know, there is no health without mental health. Although often invisible, we need to address it as a matter of priority, taking into consideration the need for a whole society approach to promote, protect, and care for mental health. When we say we need to strengthen the most vulnerable parts of our society, mental health has to be at the forefront of these efforts. That is why organizations such as Enosh, the Israeli Mental Health Association, are so important, and I'm very pleased to see that they are participating today. I would also like to thank Dr. Dvorah Kestel, the Director of Mental Health and Substance Use at the WHO, for joining us today. I would like to reiterate Israel's support for WHO's work around mental health during the pandemic and our support for their recommendations to build and strengthen mental health services in the future, especially to ensure that mental health services are part of the universal health coverage packages for equal and high quality access for the whole of the population. As we have all seen, the indirect effects of COVID-19 pandemic have emphasized the importance of mental health. In Israel and across the world, we have seen a significant increase in distress, anxiety, and other effects on one's mental health. It has increased the vulnerability of those suffering, and it has increased the number of people affected. On the national, regional, and global level, we must not forget our duty to ensure that mental health and well-being is properly addressed in our pandemic response. As we continue to face the impact of COVID-19, as we start to recover and build back better, mental health must be put at the forefront of our priorities and policies. Thank you, and I look forward to our seminar today.
Thank you very much, Ambassador, and to your staff for helping us put together this event today, to Nitzan and all the others. So thank you. We really appreciate your assistance. And due to that assistance, we have the privilege of having with us today Ms. Dvorah Kestel, who is Senior Global Mental Health Policy Expert with the WHO for more than 25 years, with more than 25 years of international experience in Europe, the Caribbean, and Latin America, implementing and advising governments on national policies related to mental health systems. She's a strong advocate for the rights of people with mental health issues. She has worked for 10 years in the development and supervision of community-based mental health services in Italy. And in 2000, she joined WHO as a mental health officer, first in post-war Kosovo, then in Albania, where she served as the WHO representative. In both countries, she worked closely with the ministries of health to help establish comprehensive community-based health systems. Since 2019, Ms. Kestel, who is the WHO Director of Mental Health and Substance Abuse. Thank you very much for willing to share with us your expertise today and for coming on. Thank you. The floor is yours.
Thank you very much for this invitation and for the possibility to join you today and present where we are, what do we see as a priority right now, and where we want to go a bit, following some of the comments that were just mentioned by the ambassador here, where we want to see mental health in the future at country level in every country. So I will share my screen in a minute. I need to set up everything first. You know how it is, the challenges we have with these issues. I hope you can see it now. Please confirm if you see it.
Yes, we are.
Great. So then I will take you through what it is that we consider the attention should be right now in the context of mental health preparedness and response related to COVID and public health emergencies in general. So we have seen, we are monitoring what is happening, of course, at country level, and we have seen that when we talk about where COVID-19 affects mental health in general population, we are monitoring different publications and information coming, highlighting increase in anxiety, in depression, in trauma-related issues, or in other non-specified psychological distress. And this goes from very low increase, like 6-7% in some cases, to more than half of the population. And that depends on the time when this information is being collected, the area, the region, but also the group of people affected, more or less vulnerable groups, or groups that are right now in a vulnerability situation that will have some increase in manifestations, or will have a normal trend. And this is changing over time. In terms of what kind of impact we see, well, those conditions that I mentioned before, but we are also looking at some kind of long-term effect of COVID-19 and some neurological manifestations such as delirium or insomnia, headache, or some other issues, as we heard, very common symptoms of COVID-19, such as the losing smell and taste, for example, right? And then what we see is that also people with pre-existing severe mental health and neurological conditions are at high risk for COVID-19 and high risk for mortality from COVID-19. And indeed, it is considered a priority for vaccination. When looking a bit at some other area that is related to mental health, closely related to mental health, such as substance use and addictive behavior, we also see increased data that talks about the elevated risks of acquiring COVID-19 and experiencing worse outcomes among people with substance use disorders. And in some cases, it could also be life-threatening. But still, we are monitoring and we are collecting data to see what exactly is that we need to take care of or pay attention to. Basically, what we say is that COVID-19 has exposed the troubling situation of community-based mental health services globally. And these services, even before COVID-19, were like this guy carrying a heavy burden directly uphill. And now with COVID-19, there is a significant and considerable direct and indirect impact on mental health coverage. So this situation has simply worsened somehow. The infection itself generates specific mental and neurological manifestations, as I mentioned earlier, but then we have to add also stigma that exerts considerable costs in itself, and also this generic or widespread spread anxiety and panic and these feelings of helplessness or the uncertainty that has been going on for a long time in many communities and is still going on because we still don't know what's coming or when or how. And that definitely exacerbates some symptoms of those with pre-existing conditions or generates those in people that didn't have problems, similar problems before. When we did last year a survey to see how services for people with mental, neurological, and substance use conditions were during the pandemic. This was done in July, August 2020, and we saw that 93% of surveyed countries, there were 130, they accused that at least one or more of their services were disrupted. Now, a similar survey was done recently. The report actually came last Friday, I think. And we saw that if you look at this graph with the different groups of conditions listed, mental, neurological, and substance use disorders, there is a microphone somewhere. I was saying services for people with mental, neurological, and substance use are still among the ones that have been most disrupted. So although there is more attention to mental health and related issues, and there is more discussion about it, and there is more emphasis on the need to support, still globally, countries did not find the way to overcome those challenges and to make sure that services are available when needed the most. Now, when we look a bit at which ones are the services more impacted, you have there prevention and promotion, interventions in schools for obvious reasons. The mental health programs in schools have been seriously disrupted, as well as suicide prevention programs. We see also that diagnostic and treatments in some cases, neuroimaging, neurophysiology, psychotherapy, counseling and psychosocial interventions also have been seriously disrupted, which is again something that is heavily needed at this time. Life-saving emergency care in the case of particularly some of the substance use related issues like opioid overdose, for example, also is there as an issue. And for the most vulnerable populations, like older adults or children or adolescents with mental health and conditions and disabilities are impacted because of those services disrupted. Moving, yes, I'm coordinating the two slides, making sure that I'm not making confusing these slides. The other issue that we are monitoring very seriously and closely is the post-acute or the long-term impact of COVID-19, and we see that is something that, of course, is increasing importance in discussions, but we still don't have a super clear picture. We are monitoring literature and talking to clinical networks, engaging some networks and collaborating centers to make sure that we are up to date on this. And what we know so far are associations with depression, anxiety, substance use, and post-traumatic stress reaction as commonly reported, in addition to the experiences of cognitive impairment or fatigue and other neurological sequelae that are also being seen. The social stigma also remains an issue of concern and is being reported in the long term. Now, during this period, and I would say as soon as February, March last year, so very soon after the pandemic was declared, we have been producing a number of documents, and many more than the ones you see in this slide are available in our website and in the page of the ISC, the Interagency Standing Committee, at different levels. And in this slide, we have prioritized some that are for the general public. Mental health and psychosocial innovations across the life course. We have work on a communication tool for kids we have worked on a tool that could be used as a self-help or to help others in terms of managing stress, but also recently a document on targeting older adults with very little text that's very easy to manage and to understand in different cultural contexts. I recommend you to have a look at. We then, the one on children is the one we are particularly fan of. It was developed with a very broad consultation among children and parents and school teachers and others. We got input from everybody, and then we developed this storybook that tells kids what's going on and how to cope with it. And it has been translated in 138, I think, languages, one of the most translated books ever. And it has over 50 adaptations in theater piece or with a sign language or in indigenous communities in different corners of the world, etc. So it is an example of how things could be used to serve those who need them the most at the time they need them the most. Then we have a number of sets for clinical providers that are being updated with the information I was providing before, with different specific clinical management tools. And then we also have some tools that were developed in collaboration with others in the context of the Interagency Standing Committee mentioned before. The reference group on mental health and psychosocial support is we really came up very quickly with tools that are for the general public and different groups in vulnerability, in conditions of vulnerability, as well as those providing immediate support, basic psychological skills for people in the for health workers or any person that is has been or is still involved in providing support to those affected by COVID, or being engaged in trying to make sure that services are there for those who need them, any kind of service at any time. And then here you learn how to cope with your own issues, as well as what kind of support others could receive. Then another piece of work briefly that we are very proud of is that we have been working in the context of mental health and psychosocial support in humanitarian settings, but thanks to the funds from the Netherlands, actually, in this context of COVID-19, we were able to deploy, I think there were around 15 missions, short-term missions for a few months at a time in different countries that needed this perspective in the middle of a humanitarian crisis and in the middle of COVID on top of everything. And this is something that has helped countries to come up with immediate support and answer where it was needed. The mental health and psychosocial support in general has been identified as a priority in the context of COVID. The WHO Director General, Dr. Tedros, as early as April last year, sent an internal sent an internal memo to all WHO country offices saying that it was very important that mental health was included in their COVID response plans, and that was very important. And then in April, we have written together with others this policy brief on mental health that was in the context of COVID issued by the UN Secretary General Guterres. That was also very important because it's calling to high authorities at country level to pay attention to mental health in the context of COVID. And more recently, then in the context of the World Health Organization, during the executive board meeting, that is the meeting of a group of countries that prepares the agenda of the World Health Assembly that is happening in a couple of weeks, there was this need to promote mental health preparedness and response for public health emergency, and there is a resolution around that updates the mental health action plan to 2030, but also goes with a number of aspects in the context of mental health preparedness and response for public health emergency that you see here in the slide is inviting countries to develop and strengthen this work as part of broader whole of society approach, and the need to promote mental health literacy and awareness, elimination of stigmatization, promotion, prevention, and early detection of mental health issues. Then the part of treatment, rehabilitation, recovery, always with a human rights approach, and to reach people at high risk and those in vulnerable situations, as mentioned before, using technologies. We did not talk now much about that, but the use of technologies, we believe this is the opportunity to scale up care thanks to technology whenever feasible. But we always need to keep in mind that not all countries, not all communities have access to those technologies. So we always need to make sure that alternative efforts are in place and we don't rely only on technology. So too fast, then I think this is one of the most important slides perhaps, because then there is this request to all countries to make sure that they allocate adequate funding for mental health. It is not enough to talk about the importance of mental health, and things need to be done, and a lot of things could be done if appropriate funding is available at country level. It is also important to increase knowledge, and this activity is an example of that, on mental health among health professionals, but also among others that are first responders, as mentioned earlier, for example, and to keep studying the impact of COVID-19 and the consequences in the long term of all these issues. We then, the same resolution proposed to provide technical, this is proposed for WHO to provide technical support to member states to make sure that those who need support to advance on the issues highlighted before receive that support, and to WHO to strengthen the request is also for member states, countries, to help WHO strengthen the capacity so we can provide that support to those countries who need that. And this is the endorsement of the action plan. So I think that with this, I will be concluding, highlighting then that what we need to consider for the way forward is that, as it was mentioned earlier, we need to make sure that in any building back better of systems at country level, mental health is included. We need to use this current momentum of emphasis or interest in mental health to as an opportunity to catalyze mental health reforms at country level, at every level, wherever is needed. We need to make sure that the mental health is part of universal health coverage, so that whenever the health system in the country advances, mental health is part of it and is a natural way of accessing mental health care through the health system or the social system that the country develops. And we need to make sure that we have human resources capacities to deliver mental health care as needed, and then that organizing community-based mental health services that protect and promote people's human rights, and they're actively involved with mental health conditions and psychosocial disabilities in the design, in the implementation, and the monitoring of services. I'm sure we will hear more about this with coming interventions. So with this, I'm stopping. I hope I didn't run too much, trying to say everything in the given time, but I'm here ready to answer to questions or comments as they come. Thank you very much, and over to you.
Thank you very much. Thank you for giving us this global view together with all the statistics of mental health manifestations. And as you mentioned, in all countries, we are seeing how the lockdown has affected vulnerable groups and others who found themselves in vulnerable situations. The approach you have presented for preparedness and response are important to all our countries. And we very much appreciate you taking the time to present your findings and the way forward that we all need to think about and address. So we appreciate it very much. And Anna, would you like to present any questions from the audience?
Yeah, there is a question. Are youth substance users at risk as older ones? There is a rumor that young people resist to COVID-19. So can you just elaborate on this? Are they youngsters are more at risk or at the same level as older ones or less at risk?
Are we talking about mental health or are we talking about COVID in general?
I believe it's connected to mental health. Are they more resistant mentally? If I understand correct this question.
Thank you, Anna. So if we talk about mental health, I would say that depending on the conditions, the characteristics, the situation, the group we are talking about, but in general, we know that children or young adults have been affected by the COVID-19 and the issues related to COVID-19 at country level that may have been, for example, not being able to go to school, not being able to socialize with their peers as they used to, and so they need to find alternative system, or the uncertainty related to studies or the future as they were foreseeing it before, prior to COVID. So this has affected definitely young people, but I think that there are a lot of efforts ongoing in a number of countries and contexts, and that means that there are many opportunities for youth to engage in alternative ways of dealing with the current situation, of interacting with their peers, with others, through social media, through phones, or through any other mean that they could have access to right now. One issue of I think importance, and it is, if I'm not mistaken, the title of the event today is resilience. When we talk about youth in particular, we can count on each one being resilient and each one having the capacity to overcome these challenges as soon as the situation improves and with the rhythm of improvement that each country will have. And listen to what's going on around you and try to connect with those that are around you would be the key message to everybody, and no matter the age, actually. Over to you.
Yeah, thank you. And what about the youngsters that are substance users? How
Well, that
they
is
affected?
Oh, thank you, Anna. I think that that's part of the concern for all people that are substance users. There could be an opportunity to change that behavior if new ways of coping with the challenges are developed. There are networks that could provide some help in current situation. I would say that it is important to reach out to those networks in your own context, in your own country, to find out who can provide help. And there is a lot of help that has been activated online or with phones, SOS hotlines that could help, and reach out to them and find the specifics of the needs that those youth could face right now, what it is available out there. There are ways to overcome those challenges, but it depends on what are the challenges and which is the context we are talking about. So it's hard to give an answer or recommendation that is valid globally on this, except reach out for help. Do not give up on the current situation. Find ways to overcome the challenges, and there are ways to do that. And there are people ready to help out there.
Anna,
thank you. Yes.
you see the question on top that's saying, how can we reach out to you and further engage?
Yeah.
To you, not to us.
Yes, not
to me. Okay. how can you reach out to me? Depending who you are, you could talk to your Ministry of Health colleagues, and through that you could reach out to the WHO country office in your country, and they will reach out to me and to my team. Again, depending on the, we have this network of communication system. Otherwise, you can write a note here, a private message, and I can provide you more details.
Thank you. And there is a really interesting question, I think, really important question. What could be done from the social media, which is affecting the younger more worldwide, and young people are moving towards the suicidal thoughts?
Thank you. This is indeed a very important question, as you said, Anna. I think, similarly to what I was saying earlier about substance use, the issue of suicide, I could provide a similar answer. There are a number of networks out there and services out there that are ready to react to someone that is having suicidal thoughts. The social media could contribute, and the media in general could contribute by sharing the information of those networks that are available to help, by sharing alternatives or the way forward when someone is considering suicide, by sharing where they could reach out to, who could they ask for help to, who to talk to. They should share the importance of talking about that, and when someone is having these suicidal thoughts, and when these thoughts are made known, it is important to talk about that, to understand what is the situation, and to find out who could provide help, and who in that network, not at global level, could provide help. We do have also some specific guidelines that you could look at them in our webpage for the media on how to communicate properly in the case of suicide. I think this is always very important, and also now when some of these issues may some of these concerns may be emerging in different contexts and situations. I have to say that recently, very recently, there was an updated information in terms of suicide, and at a global level, we do not see any increase in the numbers of suicide, and so that means that the trends at country level may be similar as they were, and that means then that networks existing at country level may be active or reactivated as needed. Over to you.
Thank you. And another question, with the shortage of professionals, how can we create more of peer support workforce? Any recommendations from your side?
Well, I think that the question should go to one of the presenters that come after me, who are from those networks. I'm sure will give a better answer than what I could. In my opinion, or from my standpoint, I would say that we need to use this opportunity that more people are talking about mental health to generate moments like this one, to make sure that more people know, for example, the existence of peer networks. This is not something granted in every country, in every corner of the world. On the contrary, there is still a lot of room to grow in that field. So maybe more advocacy. Maybe like today we have a representative from a peers group, if I'm not wrong, joining us, and this should be something that is more regularly repeated, and we could find ways to multiply these efforts and make sure that more people know what needs to be done when somebody is suffering from a mental health related issue. And there are a lot of interventions that could be done by non specialized professionals that are extremely important and that will have a very good impact. So dissemination of this as a possibility, sharing information, promoting the work that is being done among peers, I think is very important.
Thank you. Thank you very much, Deborah. Chava, back to you.
Okay, so we thank you so much. This is really enlightening and fascinating, and I hope maybe in a few months when we see where COVID is taking us, hopefully to a better place, that we can meet again and discuss this with you. So
I hope so.
Appreciate it. Thank you very much.
Thank you.
And thank you to the Meirav and your staff, Ambassador Meirav Ilon and Shachar, and we really do appreciate your helping us making this connection with WHO and all your assistance always. So toda rabah. Thank you very much. Anna, I'll pass it over to you. We're now going to to hear about Israel's experience and the famous organization called Enosh. And we thank you all for coming on today. And Anna, please take it away.
Thank you. Thank you, Chava. And yes, we move to Enosh, the Israeli Mental Health Association. And I'm really happy to introduce you to Advocate Liron David, who is a Policy and International Relations Chief Officer at Enosh. She is an Israeli lawyer and social worker by profession. She is developing Enosh global activity in the advocacy and implementation of the Convention on the Rights of Persons with Disabilities principles in the mental health field, aiming to shape better policies that support community-based services, human rights, and recovery. Prior to Enosh, Liron served as a judicial clerk in Israeli Supreme Court and a legal advisor at Israeli Ministry of Justice. She, although a member of Global Mental Health Action Network and involved with the World Health Organization work on good practice guidance document on community-based mental health services promoting human rights and recovery. Advocate David, the floor is yours.
Thank you, Anna. Shalom, everyone. I'm very, very honored to be here with Enosh team and all our experts to discuss the topic of mental health and community resilience. I want to also thank Mashav and the Ministry of Foreign Affairs in Israel and the Israel in Geneva for connecting, and Devora from the WHO that promotes different agendas that promoting community-based services around the globe. In this part of the session, we will try to share our work in the field of community-based mental health services and provide a foundation for a discussion on the importance of community in supporting people with psychosocial disabilities in different places. We had experienced a major global crisis in the past year, which showed us that it's so important to strengthen our communities and support vulnerable groups. Digitalization also highlighted the need to be part of a family, a community. So I hope that from being here together also, even though that we are on Zoom, we can share some moments of togetherness and to be a little community of people around the world that are interested in this topic. I will share our presentation now and show you some of our next 2 hours. Just tell me that you see it's okay. Yeah, great. So I will present you some of Enosh community-based services to bring us to the ground of our topic. And then I will move to our CEO, Dr. Hila Hadass, that will share some thoughts about COVID-19 responses in mental health organizations, some thoughts about leadership, safeguarding, and resilience. We will take a small break just for you to relax a little bit, because it's a lot of information and an intensive session. And we will share some stories of people with lived experience. We will host Leon Gair, our head of lived experience. Someone is unmuted. And we will have a panel discussion about community role in supporting people with psychosocial disabilities. And I think some of the questions that we saw in the chat will be very relevant to the panel. We will host Sylvia Tobelin Azula, Director of Milam Family Support Centers Services in Enosh, Shirit Perel-Levy, Director of Community Outreach, Social Services and Wellbeing, Leon Guy Meir, Head of Lived Experience Department, that you will also hear in a few moments, and Einat Lichtenstein, Head of Volunteers. And we think it is a gathering of very important roles of section in the community that we want to share with you some of the learnings that we had done in the past few years. So I want now to share with you who are we, Enosh, the Israeli Mental Health Association. As we know from the WHO data, but maybe it's different today, but we know that 1 out of 4 people will experience a mental health crisis during their lifetime, which means that mental health is everyone's story. Each and every one of us probably knows someone that is dealing with a crisis or experience himself or herself these issues. But we know that the stigma around this area is very high, and we know that the economical burden is very high due to cases of anxiety and depression. And we in Enosh are trying to support exactly that. We know that mental health is everyone's story, and we try to support people that are coming to our services mainly to get support when they are experiencing a psychosocial disability. So we all share some moments of crisis in mental health, but some of the people identifying as people with psychosocial disabilities, mental health illnesses, and our services support these people. I will share with you our services, but I want to show you Rivka, Gabi, Noah, Yuval, and Igo, and they are telling our story with their success in the recovery journey. So Israel Community Mental Health Rehabilitation Services is based in a law that was legislated in the year of 2000. And this law creates a basket of services that are funded by the government and are provided for free to people who are eligible. And these baskets of services are kind of holistic. They see the needs of a person: housing, employment, social life, family needs, the family of the person with the mental health issues, education, supportive education, and case management and dental care. All kinds of aspects that are surrounding the person and can support his or her recovery journey. So in Enosh, we are providing some of those services that are eligible by law. We provide supportive housing, social and recreation activities. We do early intervention with youth and policy and advocacy, supportive employment. We create spheres for people to gain skills and gain opportunities to be included in the workforce. And we have family support centers. You will hear later from the people in Enosh that are leading those programs about some of them. And I want to show you that our approach is a person-centered approach. When we look at the person, even if he or she are coming for supportive housing, for example, we will also look at the other aspects of the people and what they need in our perception, and we will help them gain as much tools as they need to be back independent and live meaningful life in community. Some answers to our anchors to our impact. I want to share with you our complexity in our organization. We are doing awareness work on mental health because we know that the public stigma is very high regarding mental health. So we try to raise awareness through campaigns, through activities, through bringing the community in and going to the community. We do advocacy and policy activities in many roundtables with the government, in the Israeli Knesset parliament, with regulators and other authorities of the government and other agencies. And we provide services that I showed you earlier. So if we look at who we are giving service to, so we are giving service to families, to service users who cope with mental illness, but we also have many professionals in our service. In Israel, we have more than 900 employees, and we have more than 800 volunteers. So when we look at what we do, we have a lot of voices in the organization that we want to provide service to and to support their work through the year. Person-centered approach is not just a saying. We provide and develop services that will support the needs of people. And as you know, if you don't know, I will share with you, but as some people know, Israel is a very diverse country. We have people from all kinds of cultures and religious, and we are trying to promote many services that will fit to the needs of people, whether it's cultural adaptations or specific needs like a SEEDS program that is supporting women who cope with trauma. Young adults, we understand that young adults need different services than older adults or people who are in an older age. We know that people who cope with substance abuse and mental health need a specific set of skills and tools to support their recovery, and we develop supportive housing programs for them, and also dealing with homelessness in one of our centers. We have services that are provided to religious communities, which means that the teams and the staff that support the work needs to be from the community or understand deeply the cultural sensitivities. And I want to finish my presentation with showing you one of our centers in Nes Ziona that is opening its doors to the community and bring the community in for engagement through an employment initiative. I will stop sharing and Asaf will share the movie for you so you can hear that.
לא כל טבעת דומה למשנה. יש כאלה שקל יותר להכין את הטבעות, חלק מהטבעות שהן קשות יותר ליצירה ליתר דיוק.
תסתכלו מה אתם אוהבים.
זה אני ממש אוהב.
מעולה, תשים רגע על האצבע שנראה את הרוחב.
ראובן שאל אותי מה זה אנוש, כאילו מבחינת המילה הוא אמר מה כמו אנושי? אמרתי לו כן, כמו אנושי, כאילו human.
הם במיוחד באים כדי לפגוש אותנו, שזה ממש נוגע ללב, מאוד משמח.
לי נורא חשוב שהם לומדים את הכל, לא mass production, לא משהו שרק מנקים מציקות, שהם לומדים את כל הטכניקות שיש לי לתת להם, וככה נהיים צורפים.
פעם ראשונה בחיים שלי אני חובה אהבה אמיתית, אני עושה פעם שלישית דרך אגב. את הטבעות שלנו, אמנם אני לא עשיתי, אבל היום עשיתי את הטבעת בדיוק כמו הטבעת הנישואים שלי למישהי שהטבעת הנישואים שלה נגנבה.
זה עדיין עולם אחר, אני לא מבינה כל כך מה זה, כי אני לא התחתנתי אף פעם. זה ממש יפה. מגניב.
מספיק או את רוצה עוד קצת לאורך?
לא, זה יפה. זה מושלם.
מה, אתה מקדש אותי? זה לא מטבעות יפה יותר.
אנחנו מוכשרים.
קיבלנו עזרה טובה.
מדמיין את עצמך אולי בעתיד עם בת זוג חדשה, מכין טבעת לך ולה?
למה לא? זה לא יקרה, אבל זה כן. תשמע, אחרי 43 שנים אתה לא רצית להתחתן עוד פעם, תהיה בטוח.
Thank you, Asa, for the support, technical support. And I'm now honored to introduce you to Dr. Hila Adas. Hila has held the role of Executive Director of Enosh for the past 13 years. Over the years, Dr. Adas has initiated innovative collaboration with the business sector, higher education institutions, and local municipalities, which resulted in successful business and social ventures and have broadened the reach of mental health recovery services. Dr. Adas is a member of the Roundtable in the Israeli Prime Minister's office that manages the discourse on social issues in Israel among the Israeli government, civil society, and the business sector in order to achieve multi-level changes in Israel on a national scale. Dr. Adas' efforts have led Enosh to gain international recognition. Enosh's innovative best practices have been shared with organizations around the world and with policymakers worldwide in the field of rights for people with disabilities. Previously, Dr. Adas has served as the CEO of Achvat Academic College, and she is currently a member of the Board of Trustees. Dr. Adas is a member of the Board of Directors of the Israeli Psychiatric Rehabilitation Association, ISPRA, a member of the Board of Trustees of the Academic College of Tel Aviv-Yafo, and furthermore, Dr. Adas is a graduate of the Israel Digital Leader Program supported by the Israeli Ministry of Social Equality. In 2019, Dr. Adas was chosen to light the torch of the official 71st Israeli Independence Day ceremony in Jerusalem, an honor given to inspirational individuals. For the first time, we were also proud that in history of this high-profile event, mental health was brought to the forefront of the stage. Dr. Adas called upon the Israeli public to recognize the importance of mental health, to eradicate the stigma towards people with psychosocial disabilities, and to respect and appreciate them, their families, and those providing rehabilitation services. So Hila will present her role. I will share the screen. Hila, the mic is yours. Just a second.
Thank you, Liron, and thank you, Mashab, and all the participants. It's an honor, a great honor to be here and to share Enosh's vast experience in mental health. It's a unique occasion for us. It's also an honor to expose our expertise, our models of operation that are a result of intensive teamwork, professionals and volunteers together. And also our tendency to collaborate, to connect with others, to create joint effort to meet the challenges we face. Mental health is a complex matter that needs many stakeholders to join together to pave the way. It's not an easy way to walk on. In my part, I will concentrate on the perception as a CEO, my personal perception as a CEO, about the responsibility to lead and influence. I believe that it's all about choices, how and what you do with your authority. And for me, it's all about empowerment and leadership. A CEO is a title that comes with intensive effort and responsibility, 24/7, year-round, and in mental health, it comes with an extra concern, continuity in all aspects, services, care, personal security, and operational. There is no option to turn off the machines. There are no machines. Everything is human being. As a CEO, you are obliged to take care for your people. In mental health, it's even more sensitive. Clients, their families, employees, and volunteers, that each and every one of them is part of a community. As long as they feel safe and secure, they will contribute to the community resilience. They can give back and help others rather than to be a burden. When it comes to actions, planning and preparing to rainy days, you need to act when there is no sign for a disaster, when it seems that there is no reason to put an extra effort in what everyone sees as waste of time. And in this slide, you can see what President Kennedy said. And for me, investing in building readiness to any situation, training, creating the ability to fully operate in times of emergency, terror, war, earthquake, fires, whatever, those actions need to be taken when the horizon is promising peace and quiet, not when the disaster is here. And from my experience, this is the profound meaning of responsibility and leadership. In the next slide, you can see a common phrase, or the most common phrase in Israel. And you know what? This is true. In time of emergency, you have less time to explain or to correct mistakes. You need everyone to be quick, sharp, and efficient than ever. So only if you educate and train during shiny days, you will ripe when the time comes. So in shiny days, you can act with patience, with a lot of time to train and to give all the knowledge that is needed. And any action that you take on an ordinary day will pay back on times of crisis. Actually, COVID-19 is a good example, though an extreme one, unexpected, very long, different when regular crisis in Israel that we face from time to time. This unique event reflects the importance of proactivity and preparedness. So investing in building resilience and training and safeguarding. When you do it on a good day, you will get whatever you need on bad days. And actually now I can go to the slide that summarizes my management concept and actually the way Enosh works. And to my belief, these are the anchors for successful operation. When you are in the eye of the storm, when hard days are around you and everything changes dramatically, and you need to speed, you need to work when there is no time to explain. You have many people that you need to care about and you are really responsible for them. So actually this slide is about connections, about cross effects, cross reactions, amplifications, resonance, and empowerment of people, teams, and the community. And from my perspective, everything is tied together. Actually, it's about the importance of feeling protected. It's about trust and comfort, which are actually well-being. Most of all, it's about being ready and trained. Then you can meet successfully any challenge that you face. As a CEO, you need that everyone around you will feel the same, will feel secure and prepared. You need hundreds of ambassadors that will carry the same message, the feeling and the capability, and pass it forward. You need to know that each and every one feels responsible to those around him. And that's exactly how you influence and how Enosh operates and build resilience, from personal to teams to organizational and to the community. It starts, as I said, with leadership, responsibility and influence, and strategic planning. Put the right time and the right actions on time. It continues from our perspective with safeguarding concept, what to do in emergency and how to build resiliency, preparation, training, drills, tools, and guidelines. And obviously, all those are based on our values, that the person is in the center, as Liron said. We need to see the person and his needs and to see him as the person that we need to look for. So it's all about people that are with you and that you're responsible to their safety and to their lives. And you have to keep this vast knowledge managed. For us, the digitalization and knowledge management are an anchors, and you need that everybody will understand them, that would be clear, simple, and accessible. And digital helps a lot here. So this is the way that we build confidence and trust, which gives the opportunity to balance between flexibility and discipline. You need people to discipline in times of crisis, and you need to be flexible enough to meet everybody's need that might be very specific. So to conclude, although I can go on and dig on about leadership and preparation and resilience and how to be flexible, etc., I'd like to go back to the beginning, and that it's all about how we believe we need to action, how we care for readiness and how we lead. And actually, it's much simpler than it looks like when you do it on the right time. The effort you need to put when it's a peaceful time is a gift to every CEO that he actually can give himself. And when you do it, the results in continuity and safety emerge immediately and pays back in all aspects. So again, thank you for the opportunity to share this experience. And hopefully we won't need to use resilience in many more occasions.
Thank you, Ila. And we will now move on. I will share with you some more interesting informations about us. I want to share with you the process that had been done in one of our centers of creating a series of lived experience stories of 6 people that were gathering, not together, each and every one of them alone, for a project that is called Benafsham, in their souls. And these 6 people are Enosh participants. The beginning of this story is when the director was coming to volunteer at Enosh Center, and he's telling that he was very, very much holding stigmatic perceptions towards people with psychosocial disabilities. And after he came and volunteered in our centers in Tel Aviv, he and the manager of the center, Ms. Tali Peretz, thought to create, he told himself, I need to create something that will raise the awareness to the public to these important stories. And he and the manager of the center decided to create like a call for people in our services to come and tell and share their stories. And he took the tool that he had, which is directing and cinematic work, to create this mini series. And it's not that they just show the stories of these people in the Israeli National Broadcast Corporation. They also created a small community of peer support with those people. They are holding a WhatsApp group for the past 3.5 years, maybe 5 years, no, 3.5 years. And it was interesting to see these mini-series coming out in the COVID time in last year in 2020. It had a huge impact in Israel, more than 3.5 million views on these episodes. And I think it's because people felt very connected to the messages of these people. I will show you the group. This is the group of the 6 people and the director and the manager of our Tel Aviv branch. And they are still a community that supports each other in times. And what we picked up for you is the story of O, and he shares his coping with depression. I will now stop share and Asaf will show you the movie on his screen.
Hey, 1, 2, hey, check. It means no worries for the rest of your days. It's our problem-free philosophy. Hakuna Matata. היי, קוראים לי אור קרבי, אני בן 26, וההתמודדות שלי עם דיכאון, חרדה ואיזושהי רמה של דיסטימיה. לא יוצא לי כמעט לצאת ולהיפגש עם אנשים. אפילו לעשות קניות בקיבוץ מאוד מתקשה לעשות. יש לי מעגל חברים לא גדול במיוחד, שאני מתקשר איתם בעיקר דרך דיסקורד ודרך שיחות וידאו וצ'אטים. זה קצת מקל על האלמנט הזה של החרדה החברתית, שאתה לא מרגיש אנשים סביבך. כל פעם הצרחה הזאת, אני לא יודע, אני מתחיל אותה מוקדם מדי, או שהוא פשוט נשמע אולי יותר מפלצתי, אבל זה הרבה יותר עצוב.
אוקיי, בואו נריץ שוב פעם רק תעניינו חברים.
בא ואני הסתדר... בא היה יצור גדול מאוד, מפחיד יותר מכל החיות על ומפה. פחדתי מאוד כשהוא כעס. נהיינו חברים. חברים טובים מאוד אפילו.
לזה האמנתי. מה התכנון שלך להמשך היום?
לישון.
למה?
סתם קמתי ככה על הצד הלא הכי טוב.
מה, התעוררת בלילה עוד פעם?
דאונים, או משהו חדש.
לאט לאט. עוד כמה ימים כנס. תרגש?
כן, מתרגש. יהיה לי קצת קשה, אני... עם החרדות וזה, יהיה לי קצת... כל הרעש וגם הגירויים הוויזואליים זה כזה... לפעמים קצת יותר מדי בשבילי.
אבל אתה מגיע, נכון?
יהיה בסדר. לפנות בוקר. אני בקושי מחזיק את הראש מעל המים. אני לא בוכה. אני מרגיש את המשקל בבית החזה, מושך אחורה ולמטה. הדיכאון פיזי בשבילי. זה יעבור, זה יעבור, זה יעבור, זה יעבור. מחר אולי זה לא יקרה. מחר אולי יהיה יום טוב. אתה לעולם לא תצליח. אתה לעולם לא תמצא אהבה. אתה לעולם לא תתרום שום דבר לעולם. אתה תמיד תישאר נטל חסר חשיבות. תמיד תישאר טפיל שלא מסוגל לדאוג לעצמו. אתה תמיד תישאר שמן, מסריח, מכוער, עצלן, לוזר, אפס, מגעיל, טיפש. כששואלים משהו, לא קרה כלום. אף פעם לא קורה כלום. גם בתקופות הכי טובות הדאונים תוקפים. בלי קשר לכלום. בלי התראה. פשוט רצון לשכב במיטה ולא לקום. לקבור את עצמי ולהיעלם. הזיכרון הראשון שלי מדיכאון הוא מגיל 10. בתקופות הקשות של הדיכאון אני עולה במשקל. יותר דיכאון, יותר שמן. בסבב הנוכחי עליתי כמעט 30 קילו. לקח לי שנה להוריד אותם חזרה. זה מעגל שחוזר על עצמו שוב ושוב ושוב. אני בקושי מדבר, אם בכלל. כשמדברים אליי אני לא עונה, אני לא יוצר קשר עין, אני נאטם. אני משאיר הכל סגור, שלא ייכנס אוויר, שלא ייכנס אור, שלא יראו אותי, שיהיו כמה שפחות עדויות לזה שאני קיים. אני מתבייש בעצמי. בחדר שלי אפשר לראות ולהריח את הדיכאון. רוב הזמן אני לא פה. זה מה שמציל אותי, לא להיות בכאן, לא להיות בעכשיו. כי הכאן והעכשיו גורמים לי לרצות למות. הדיבוב והשירה מחזיקים אותי בחיים. אני יכול לעשות את זה. אני אצא מזה. אני אהיה בסדר. מחר אולי זה לא יקרה. מחר אולי יהיה יום טוב. זה יעבור, זה יעבור, זה יעבור, זה יעבור, זה יעבור, זה יעבור, זה יעבור.
אני לא יכול, כמות האנשים, אחי, יש חרדה. בואו נתרחק עוד קצת. סורי. סליחה. סורי. הכל בסדר, אחי.
הכל בסדר, אני רואה אותך ואנחנו פה, אני פה.
לא נורמלי.
נכון, זה אדיר, זה מדהים.
כל היום הזה אני בסנסורי אוברלוד בקטע החברתי, כאילו זה מטורף.
מובן לגמרי. אין לי מושג אם אתה יודע, אבל זה הקול הישראלי של ריק ומיר, מריב ומורתי.
אז אני הכרתי אותך ולא ידעתי שזה אתה.
מאור, לא מניח.
נכון לך?
בואו, איתמר, נעים מאוד. מסתבר שהיה איזה ילד שהלך אחריי, ואיזה 3 פעמים הוא הבין, איכשהו, אני לא יודע איך, הוא ידע שאני ריק מהדיבוב.
הוא ידע שאתה ריק?
כזה, 3 פעמים נראה לי הוא קרא לי, ואני לא קלטתי שזה אליי. כי החזית אותי, לא ראית אותי.
אוי, מדהים.
לך כיף, אני עוד שנייה בוכה פה מאושר. אם לא היה לי חברים כמוכם מדיבוב ישראל, לא הייתי מגיע לכנסים, לא הייתי מגיע ככה ויוצא מהבית ומתפקד ברמה הזאת עם אנשים. אני לא חושב שהיה לי גם חברויות כאלה בחיים, אז תודה, באמת.
Thank you. And after this emotional movie, we will take a 5-minute break so people can refresh, can drink water, go to the bathroom. We are here if you want to share some thoughts on the chat, but I will put some slides so you will see. We will meet again in Israel time. It will be 2:25 in your time zones. It will be 5 minutes from now.
Thank you.
Thank you, Liron.
Terminó de hablar. Micrófono.
Hi. Are we back? Do you hear me? Okay, great. I'm fixing something here. Okay, thank you everyone who joined us. We are here in a webinar on mental health and community resilience, and we came back from a 5 minutes break. We heard about community-based services, and we saw a film about the experience of a person with depression. And a lot of you asked me if I can share the link to the video. We can share the Hebrew version, and I will put it on the chat later. But the English subtitles, we need to ask the director. So we will get back to you if we will see that we can share that. We will now host Ms. Leon Guy Meir, Head of Lived Experience Knowledge at Enosh. Leon lead Enosh Lived Experience Knowledge. Prior to Enosh, she was managing the first peer support program in the psychiatric hospital in Israel. In the past 7 years, Leon is a public speaker in the field of trauma, DID, dissociation, and recovery in mental health. Through her personal journey as an early childhood trauma survivor, Leon is sharing the knowledge she gained. In addition, Leon is a graduate of the first Open Dialogue course in Israel, and she is a certified personal medicine trainer by Common Ground Program USA, led by Dr. Pat Deegan. Leon is also a member of the Global Mental Health Peer Network, and she believes that the personal experience and the people capacity to lead their own personal recovery through personal experience can create a huge change in the community. Leon will discuss the importance of lived experience in mental health services.
Hi,
Leon,
Leon.
the floor is yours. Hi.
Thank you very much for all that here. Stay with us. I'm very, very, very excited to be here with you today. And I use my soap to smell, and it helps me with my anxiety now. So I hope it will be okay. And I'm very excited to give pieces from my story, go through mental edge experiences. I'm thinking that I always felt different. Some things happened to me that I understand it's strange things or bizarre. I didn't actually understand what they are or why they happened to me. And I was thinking that I'm the only one in the world that have these experiences. It was clear for me that if I will tell people around me about the voices that I heard, they will think that I'm crazy and take me to an hospital. I felt huge loneliness for a long time. In my adulthood, I was living in Belgium. I wanted to learn dance theater for professional, and I work in a work that need to be awake in the nights, and I was sleeping in the days. And I think this was the trigger which break me physically and after mentally. it's end in a way that my sister need to came to Belgium and take me back to Israel. And I need to sell all my furniture, and it was a big crisis. I was waiting for be hospitalized in a couple of months in a hospital. I barely eat, I barely drink. I just really want to die. In the psychiatrist ward, it was my first time with the mental health system. I met a lot of professionals which interpreted the thing that I've done. They told me they know what I'm doing, they know what is good for me to do, and nobody asked me what I went through and what happened to me. Everybody looks on my symptoms. I was in a closed place, far away from nature, which I knew that helps me, and far away from the thing that helps me. And the loneliness was changed to there is no place for me in the world. I didn't understand why they treat me like this. Even part of me that hold the trauma that I've been through in my childhood, even think that I deserve this kind of treatment. I felt humiliated, misunderstood, and I almost convinced that I'm a chronic mental health patient. And then something happened. I saw a video in YouTube on a woman that coped with a dissociative disorder. She was a survivor of childhood trauma, and she was thinking about it and talk about it. And from a couple of minutes that I saw she was talking, I understand that she knows something about my experience. She knows what I'm going through. After a couple of days, I sent an email to this program. I asked for them to connect me with this person. And a couple of weeks after it, we had a video call. She told me about a conference that a survivor creates for people for like us in Orlando, far away in the United States. A couple of years after, I was managed to, before the corona hit us all, I was managed to fly and be there in Orlando. It was the first time in my whole life that I felt home. I was meeting hundreds of people who described the same experience as I did. And I felt for the first time that I don't need to really hide part of me or who am I. So what's really happened there? I understand that I'm part of community. I have a community. I'm not a damage. I have an explanation and a reason for what I experienced. And I wasn't alone. And it was very important. In spite the community was very far from me in the United States, I had a couple of connections until today. And I think it was helped me to get confidence. And this is a power of your community for me. It affects immediately on my resilience. At the same time, I was started to work in rehabilitation services in Israel. And in one point, I was asked professional to give me the opportunity to lecture to them. Actually, I begged for them to give me. I wanted to give them for my experience, for my knowledge. And at first I was doing it voluntarily. And very fast after it, I was asking more and more to come and tell my story and share from my experience with a fee in paid. I lecture about people like me, superheroes that went through a traumatic and hard lived experience. And I told them that I'm normal, this experience are normal. I wanted to talk about what I went through and what can help people like me. Then the next step was understanding that this knowledge from lived experience has a professional value, that it's a professional at itself. I help people to go through the recovery challenge and the recovery journey of them. I was a training peer support worker. I was managing the first peer support program in Israel. And today I'm the head, I'm leading in Enosh, the lived experience knowledge department. We are thinking about implementation, in a very, very big organization in Israel. I'm helping to create a community inside the organization and outside, community of lived experience, community of peers, people with lived experience, community of family member of people with lived experience, digital community, not digital community. And also I'm very thankful for all the person in my environment that have no pity on me. The people that had respect me, that give me value, that encourage me to do something for me and for the society. And I think maybe to get out from my comfort zone, like this lecture. And mostly not to be ashamed of who am I and my experience. I'm thinking that peer support and knowledge from lived experience are crucial resources when you build resilience, community resilience, and when you support people with psychosocial disabilities. And if you are a person that have influence in your community, please help people to get together and feel not alone. And then give them to lead you to how to create a community with diversity, people in it, and how to build services which are good for these people. I hope that in the future, we won't need this kind of webinar and this kind of talk, because all the community were very inclusive for people like me and for all people. And maybe we will build a healthier community. Thank you very, very much for listening.
Thank you, Leon. We saw that some people want to ask you questions, and also chickens. If you can, Katrina or Anna, can you share the questions?
Yes, Kajina Rogers, Kajina, please, you wanted to ask something? You raise your hand. Rogers?
Okay.
Okay.
Yeah.
Yeah, just a moment. There was one more question.
I wanted to, if you can elaborate a little bit, Leon, about what does it mean to create lived experience profession inside mental health organization. What does it takes from you, but also from the organization? What do you need to get the support to implement it?
Yeah, I think Dr. Patricia Deegan, which has lead the recovery, the recovery approach for a long time. She was calling peers support workers how you said it in English?
Disturbing people in the organization.
Yeah. So she said we need to disturb what's happened. For me, it's disturb the stigma and change and give something else that we can work with. And I think for me, it's hard and it's crucial to see both profession working together and learning from each other, the professionals and the lived experience people. Because I think if we are not working together, it's going to be very hard to do any change or leading any approach in the organization.
Thank you. And we also hear you in the next panel. So if there are not other questions, we will move on.
No questions for now. So yes, please, let's continue.
Okay, great. So now I'm happy to introduce you to our panel of speakers. As you know, the community has a significant role in supporting people with psychosocial disabilities. But what exactly is the community we see in front of our eyes? That is what we are going to discuss in the next half an hour. We brought 4 leaders in ENOSH services to share their views on different parts of mental health support in the community. And I will present them and we will ask them some questions. And I hope you can see them when they are talking. So first, I want to introduce you to Shirit Perelevi. She's the manager of the Department of Community Outreach, Social Services and Wellness. She's a graduate of the master's degree in criminology from the Hebrew University in Jerusalem. She is involved in development of services for marginalized communities for more than 16 years and has gained vast experience in managing recovery and rehabilitation teams. For the past 3 years, Shirit is leading her department, which supports all social centers of ENOSH, and we have many centers all across Israel, in the fields of volunteers, well-being, lived experience, and community collaboration. The second speaker is Sylvia Tobelin Azula. She's a psychotherapist and holds a master's degree in social work with specialization in mental health rehabilitation. In the past 10 years, Sylvia is managing ENOSH Family Support Services, which provides counseling for thousands of family members of people with psychosocial disabilities. And last but not least, Einat Lichtenstein is the head of volunteers at ENOSH. Einat is a graduate of psychology and criminology from the University of Ariel. She specializes in volunteering initiatives and is part of Israel Volunteering Committee course of volunteering management. And Leon, which you already know. So Shirit, Einat, and Leon, I want to start with you and ask you and of course others here, in your view, how does the community can support people with the psychosocial disabilities? So we will start with Shirit.
Hi, hello everyone. I'm very excited to be here. And thank you, Liron. This is a great question. And we at the Community Outreach Department are asking this kind of question all the time, especially in this time of the year. People who cope with psychosocial disability and mental health issue are many times excluded from the community or not feeling as part of the community due to the stigma, self-stigma and public stigma. We find that a meaningful involvement in the community is a meaningful part of the recovery journey. People are surrounded in a different community and groups, family, peers, local community, volunteers community, and more. Each group creates sense of belonging. Belonging to the communities and variety of support can help the recovery journey and one's inclusion in the community. Community inclusion creates community belonging, and this part can help the person to build his or her well-being. Inclusion implement is a meaningful way to create connection that not only support one's life, but are also building a community. In our community outreach work, we promoting community engagement through a community events group that brings the community in, peer lead group that supports the service user to gain confidence and cope with internal stigma, volunteers and support them and supporting for them through their community engagement. And also promote volunteering among our service users. Thank you.
Leon?
Yes. So I think we need to start with believe that people are experts their life, their experience in the recovery journey. Because I think people in the recovery journey needs to have person, at least one, that believe us when we cannot believe ourselves. So I think this is very, very important. Not to be afraid of diversity, because people with lived experience or with psychosocial disability can maybe act or be in a different kind of being in some part of the journey. And I think we need to embrace this diversity to create this community, like Shirit said. We have a right, we have a ambition, we have things that we wanted to do, like have a family and have a professional and to be influenced. We want to be influenced on the community too. So this is important for me. And I think less to say to them what to do and more to ask them questions, more to hear what they have to do, to say, to ask them what happened to you or what can help you. It's a two question which can be very helpful in this. And at least to know the potential of lived experience, first for the person and after for the community, for building good services, and even for services for all the community. I think this is my perspective.
And Einat?
Hi. First of all, shalom from Israel. I'm very glad to be here. Thank you, Liron, for the experience. So volunteerism in Enosh is an essential community circle for our service users who cope with a psychosocial disability. Enosh has started from volunteers, actually, brave women who were gathered to promote the welfare and well-being of their loved ones, who were hospitalized with no connection to the community. They started to create community spaces for them to increase the participation in every life aspect. Through the years, the organization became more and more professionals that supported the mission. But volunteers have always been our proud leadership and essence. Today, the organization is large and provides many services in the mental health field, but the volunteers are always part of the triangle of the service users, professionals, and volunteers. Just a minute. Excuse me, just a minute. Our concept of volunteering has also changed through the years, from volunteering as a charity and solidarity to professionalization in using the resource of volunteers, so it will help us to understand what are the core needs in the field and how can the volunteers address these needs according to the organization mission. Volunteers need to understand the field, the work, and their qualification. We need to get to know the volunteers and their motivation to see how they can best serve our service users' needs. Above the value of contribution to society, we build on volunteerism more infrastructure, how to build a better community in our organization in every center local environment. Now, I want to share with you, please, some feelings of our volunteers in a short video.
Asaf will share the video.
אני חושב שהדבר הכי משמעותי הוא באמת העניין הזה של הנקודת מבט של כל אחד. זאת אומרת, זה חידד אצלי את ההבנה כמה לכל אחד מאיתנו יש נקודת מבט אחרת על החיים. זה היה חלון מאוד מיוחד להיחשף לזה.
אני מרגיש משמעותי ואני מרגיש את התרומה שלי, וזו באמת תחושה שהיא קשה לתאר אותה במילים.
זה ששנייה עוצרים את הפעילות הזאת של החיים, את השגרה היומיומית הזאת, ומתפנים לאיזושהי פעילות, לא משנה מה, אני חושבת שזה העניין בפעילות החברתית, איפה שאני בחרתי להתנדב.
בעיקר זכיתי לקבל חשיפה ראשונית לעולם הזה של בריאות הנפש, בנוסף לעובדה שאתה באמת עוזר לאנשים.
גיליתי כוחות נפש עצומים, אנשים שנלחמים בחיים ומנצחים אותם כל יום מחדש.
תהליך שאני עובר פה עם עצמי זה דבר שאני לוקח איתי גם מעבר לשעות ההתנדבות.
Thank you, Einat, Shirit, and Leon. You all provided some perspective that we are dealing with every day: volunteering, community outreach, social centers, and lived experience. And now I want to move on to Sylvia, the head of our Milam Family Support Centers, to ask some question about the role of family. And I think it's a question that is occupying a lot of people around the world. Sylvia, so one of the most important support pillars can be the family, but we don't hear about it so much. I want to ask you and hear a little bit more about the family role in supporting people with psychosocial disabilities.
Shalom, everyone. Thanks, Liron, for inviting me to this important webinar. I want to highlight the need for services for family members and other caregivers of persons with mental health issues. In fact, coping with a psychosocial disability of a family member can be a challenging experience. It can provoke emotional, cognitive, and practical needs for all family members and other close caregivers. The attention in the mental health field is usually focused on individuals with a mental illness, yet their family members, spouses, parents, children, siblings, and other meaningful caregivers are often referred to as the silent partners and are in fact very much impacted. Lack of information about the illness leads to much confusion and sometimes includes a sense of shame, fear, anger, and helplessness. Many family members blame themselves in the fact that there is a mental health crisis and illness in the family. It's interesting that when we have a physical illness, people ask and get support naturally. They don't blame themselves for having an injury. But unfortunately, in mental health, it's different. Stigma is the main barrier which makes everything harder. Many family members feel shame and keep it a secret. This happens in the most vulnerable times when they need all the support they can get from the community. The result is that they stay alone in their hardship. Families need support to build their capacity to cope, care for the ill family member, and come to terms with the disability and its implications. Families need support. They need someone to share their thoughts, emotions, understand better the situation, and gain information on the resources that are available for them and for their loved ones.
Thank you, Sylvia. Can you share some of the lessons on the practice of family support and its impacts?
Okay, so we know from research on family support that the support of family members plays a significant role in recovery. Liron, I want to share with you and the audience some insights from the practice. First of all, individuals who enjoyed the support and understanding of family members were better adjusted, more motivated, and experienced a quicker and more effective recovery process. family support can reduce hospitalization rates and symptoms and increase recovery results. Support for families also promotes the well-being of the family members and caregivers themselves. Interventions with families reduce stress, anxiety symptoms, and increase control, security, and physical health. We know that personal and group supports can provide an emotional response to the needs of families. The support can reduce emotional burden, loneliness, shame, and guilt, and provide knowledge and tools on the illness, and provide efficient coping skills. It can also develop a feeling of togetherness, so important, due to being a group member with common aims. A national scale family support model can be learned from the Israel Community Rehabilitation Law. Part of the basket of services that the Israeli Ministry of Health is providing are family support. The centers are governmentally funded and spread nationwide and provide free counseling, group support, training and education for professionals, family members, and other caregivers. To promote services accessibility, the service is free of charge and there is no need for any professional referral. I am so proud that I have the privilege to lead a national Milam Family Support Centers. A few words about the centers. We operate in Enosh in Israel, 6 centers that provide individual counseling, group and peer support groups, lectures, workshops, and legal aid to family members. An important part in our approach is leaning on lived experience of families and of people with mental illness, just as we heard about Leon. We are very glad to work with her and to learn each day how can we be better professionals in this area. Now I want to share with you a short video presenting the family experience. Asaf?
מילם הצילו לנו את החיים. בהתחלה לא דיברתי על זה. הסתרנו. הרגשתי שזו בושה.
צועדים על קרקע לא יציבה.
זה היה רק לשרוד, לשמור את הראש שלו, ולפעמים גם את הראש שלנו, ממש מעל המים.
הרגשתי
הכי לבד בעולם.
לא היה לי את מי לשאול או עם מי להתייעץ. חברה במצב דומה סיפרה לי על מילם, לא הכרתי לפני. קודם כל, ההבנה הזאת שאני לא לבד.
לא לבד.
זה מתחיל מהעזרה הכי פרקטית, לקבל הכרה בביטוח לאומי.
הרצאות, סדנאות, קורסים.
ולקבל עוד זכויות שמגיעות לנו בקהילה. לשבת עם מטפלת.
למשפחות במצב דומה לשלנו.
להבין
שאנחנו לא אשמים.
ומפה אפשר רק לצמוח. במילם ניירו אותנו. נתנו לנו להבין שאנחנו הורים ואנחנו הורים טובים.
ההרגשה שיש לך גב.
מישהו להישען עליו.
גם בסיטואציות הכי קשות.
זה הבית שלי.
זה השפיות שלי.
זה בחינם. רק להרים טלפון.
כשמישהו מהמשפחה שלכם מתמודד עם בעיה נפשית, אתם מתמודדים יחד איתו. אל תשארו לבד. מילם פה בשבילכם, כי בריאות הנפש זה לא רק הסיפור שלהם, זה הסיפור של כולנו. השירות ניתן ללא תשלום במימון ופיקוח משרד הבריאות.
Thank you, Sylvia. So I want to ask all the panelists, Leon, Sylvia, Shirit, and Einat, about an example to community engagement in your areas of work, in volunteering, in lived experience, in family support, and in community outreach and social services. Can you share some examples, and you can share more than one? And I'm inviting also the audience to start and think about more questions that raises through this panel, because we also have time for questions at the end. So we will start with Leon, Einat.
Yes, I can start. Okay, so in the lived experience department, we are part of international lived experience research, which includes six countries. I guess there is people from these countries here in the audience. It's Tanzania, Uganda, India, Israel, Germany, and England. And this research is very big, and we want to see if peer support is good as we think, or as the same research say. And in the upside it's using peer support in development empowerment services. So we think if you put peers in the organization, you in potential you can have influence and grow from there. And in upside we are doing, we had a training for peer support worker, which lead peer support group. So all the participants in the group are people with lived experience, and this part is very, very crucial for this, without professionals. And I think what is so powerful of it, it's when I sit near to someone in the group and we are equal, and he getting his goal, and he's getting a family or a degree, I'm thinking to myself, maybe I could too. So it's expand the narrative of the life, and there is time that it's break your self-stigma. So this is upside, and the other one that I can say, it's a dialogue project. We call it in Hebrew Dusiach, and we are support people. We give them a training about how to use their story for have a dialogue, for have a presentation and lecturing from the lived experience. And they are doing it all over Israel to a very diversity audience. And the purpose, of course, is to break the stigma and to meet with people with lived experience in Israel. So I think this is two parts of lived experience. One is in-house, and one is getting out to the community to change it.
Thank you, Leon. Real practices on how we can do that. Einat or Shirit or Sylvia?
I can give. There's a lot of examples, but one of our, I think, very meaningful example took place. It was a meaningful cooperation between students, young students from a local school, and one of our centers, that young students started to volunteer in the center, and eventually both sides, our Liron, help me, מתמודדים is
people who cope with psychosocial disabilities.
Sorry. Yeah. Sorry. And the volunteer.
No, you don't need to apologize. We are all not speaking English as our mother tongue. So.
Okay. What I'm trying to say, that the cooperation and the connection between both sides led to organize a big happening to the community, for the community, which actually both sides took a very meaningful doing to organize this thing, and it was amazing. It was amazing for the community to see such a cooperation. And I think the cycles that we're talking about were not, how do you say shakuf? Sorry.
Transparent.
Not clear, transparent?
Transparent.
Yeah. So this is one of the meaningful examples that I can give you.
Okay. So I wanted to give an example also, one of many. I want to share with you our basketball league program. This is one of our flagship programs that we have as part of the community inclusion. It is a national basketball league that has more than 150 basketball members that are training regularly once a week with a coach and had friendship tournaments twice a year. The project is operated with professionals that provide mental health support, people who cope with mental health issues, and volunteers. This project is cross-sector collaboration between municipalities that allows us to use areas and the field, governmental office, which found some of our program, and private sector for sponsorship, communities that support us as audience, and volunteerism, and professional in the mental health field. This collaboration enables us to support our community inclusion. Our society has many resources inside, many qualities, capacity, and more. And we need all the time to be aware regarding our needs, so we can aim for better collaboration that will bring results for our service user and will benefit the partners, community, and our service users. So this is one of our very, it's a good example to see how we get together and work with a community.
And I was sharing some of the pictures from the league for you to see. Yeah. Yes, Sylvia.
Yes, in fact, Liron, when you asked us to think about examples, it was a very good opportunity to stop and find out that we have a lot of examples, and it's surprising, and I'm very happy because I think it's very important to think all the time as how the community can be together with us in the programs. So I picked up two examples. The first one is the engagement that we have in our annual two-day Milan conference for families in a hotel, which with professional lectures aiming to provide knowledge. We go there for 2 days, all the families, about 400, 500 families. And the most important part of the conference is that it creates a feeling of togetherness as a community. Is something so special for the families, but also for us as professionals to understand how powerful is the strength of the community. The other example is related to meaningful connections that we see in the centers. It's something about the COVID-19. A year ago, we were in a lockdown in Israel on Passover, Pesach evening, a very important Jewish holiday, everyone alone at home. So the Families Club in Milan Center organized a Zoom Passover to lonely families and created a virtual and very special communal celebration. When I heard about it, I must tell you that it was a so exciting thing to understand how the families decided to be together and not leave anyone alone in this important day of the year.
And I want to share the Milan website just for you to see some of the in times where we met together. It was a conference like that. So you can see some of the activities that people are doing during the conference, and you can see the connections that are created in these interesting gathering once a year, every time in a different hotel. And all the family members, professionals, people with lived experience are gathering together to learn, to be, and to create a community. So that's a little bit about Milan services. And since we
Liron,
have,
can I say something else?
Yeah.
It's very interesting that on the COVID we cannot do any. We couldn't do at this time another conference in an hotel, but we decided in the last March to do a Zoom conference, and we were very surprised about the 600 people that was in the Zoom for hours and hours from 4 afternoon until 9 p.m. And it was very, very exciting. Oh, is it?
I'm sharing
Great. You can see the pictures, yes.
Yeah, so everything is on the Milam website. Yeah, yes. I will share it in the chat, the website. So my final question for the panelists is if you have any tips for people who want to implement better services or to create services without many resources, because we know that we have an audience from around the world, and some places have support for families, some places have volunteers and some not, and we want to provide you some tools to create the change.
Maybe I will start. So I'm thinking about my tip is like, it's like we have an example, so it's going to be example with a tip. When we start to implement the lived experience in Enosh, we start to build, we ask for people that want to help us to do it. Like who want to do it, want to learn a bit about lived experience, want to help us to understand what to do with this in the organization. So we get to 20 to 40 workers from the organization that get together once a month, and we learn together the other perspective, because in the group there is people with lived experience and people without, of course, like in the community. And we didn't ask specific for people to be this or this. All can be welcome. And we ask after, I think the 5th meeting, or maybe the 4th, we ask the people to get to 2 groups, the people with lived experience and the people without. And it was very hard for people to decide if they are here in professional or lived experience, and we didn't decide for them. They can choose, of course, to be one of the group. And after we ask them to write what they want the other group knows about them, and we ask the 2 groups to do it. And after we get what they wrote and read it together, all together. And it was very, very nice to see the 2 perspectation. There was very different things that all group said, but there is something that were equal. The both group want to be wanted, want to be understand, want to be together, don't want to fight, don't want to. So it's in the difference, and to make it 2 groups, we get really a connected group that want to work on a lived experience department in our organization, which were very, very powerful process, I think. And we learn a lot from this worker, what we need to do, because we are working in the mate, how we said mate, in the manager perspective.
In Enosh headquarters.
Yeah. And the worker bring the field and what they wanted to do. So it was, I think it was very, very powerful. So it's a tip and an example.
I want to add more power to the things that Leon just said, and she talked about it earlier when she was sharing with us her story. I think that a person-centered approach is not just a praise. this is the way of life. And I think that if we want to increase community involvement, we need to ask, share thoughts, and not to be afraid to reach out. And to really be relevant to people who cope with psychosocial disability, we need to listen, like Leon just said, and she said it also before, to pay attention and to learn from people with lived experience, and to find the right way to build an inclusive community. So I think we all need to be part of this. So this is my tip for today. Thank you.
I think my tip is to make the process of volunteering much more specific, to get to know better the volunteer, what is his motivation to volunteer at Enosh. And during the way, give tools, talk to them a lot. Let them feel that they are very necessary for us. They're not here because of a lack of financial resources. Quite the opposite. We need them because there is no replacement for volunteers. And I think that the minute they feel they're very meaningful for us, for Enosh, so they stay much longer to volunteer, and they're doing much more meaningful work for us. So this is my tool.
Thanks, Sylvia. One sentence about tip.
Yeah. Well, we know that the sooner people with mental illness and their family members turn to get support, there is a greater chance to promote a recovery process that will be meaningful to both family members and the person who cope with mental health issues. So my tip for today is, we talked a lot about that on this webinar. That is why my main recommendation is to encourage family members not to be alone and to get support. Even if you live in countries that we don't have family centers, it's okay. Maybe volunteers, maybe the professional. Everything you can do to promote and recommend a family member to get help is so, so important. So that's my tip for today.
Thank you, Sylvia, and all the panelists. We are ending the panel, and I want to open the floor for questions or comments of our attendees or our panelists, if you want to reflect, or Anna and Katrina, if you have some thoughts or comments.
The only question actually we have now, it's the question to Leon. Was it how hard it was for you to find a job? Actually, the whole session, all the process of employment for people with psychosocial disabilities. If you can say a few words about it. Was it
employment during COVID-19 or because of COVID in general?
Yeah. Yes, it is. I think I can say that usually I had to work for a year, and after half of the year, I was feeling that people will know about me. It gets very intimacy in the relationship, in the work. I was working in educational things, and I was working with horses, and it was feeling like almost there will be a time that someone will know that I'm crazy and I need to run away before it happened. So I was, of course, very good at my job. I end the job after a year, and I thinking about getting to another place in Israel, and actually it wasn't about getting another place. It wasn't about to run away. So in my job in Enosh, in the first time that I was working in Enosh, I was a guide in a services, home services that help with the home things. And then it was the first time that I told my story to my manager, and expose it. And it was the first time that after 1 year, I didn't need to run. I think the energy of running all the time and hiding, it's a big, big energy that our people, our employee are working to do, instead of taking this energy to the work or to the life. So for me, it was it's like I felt free to do it. I think it's hard, because you think in the morning, if you go to the work and you are feeling a bit not really happy, you think people will judge you and tell you that you are, tell after that you are in depression or need to hospital or something like this. So I think it's hard, but for me, it was really release from hiding. And after a year, I started to work in the hospital. So I had to leave Enosh, but I didn't want it. So yeah.
Thank you very much, Leon. There is another question here in chat. Could you give some general recommendation for the case of university students? How can we, as authorities, as university authorities, can be aware and help our students? Help in what?
I can say that it's interesting because in recent years, I see an awareness to students also in Israel, and but it's a very important part of the university role to address people with disabilities in general and accessibility, and specifically to provide services for students with psychosocial disabilities, which are most of the times are the least priority is for psychosocial disabilities. We can see a lot of accessibility features that are very fit to the needs of people with physical disabilities. But when it comes to psychosocial disabilities, there is a lack of resources and a lack of awareness among the universities. And we also trying to promote that in the policy advocacy level. And I can tell you that in Israel, there was a conference about how to promote better services to foreign students that are coming to Israel and are dealing with mental health issues. Maybe someone from Enosh can also reflect on that.
Yes, we also have programs in the university for the students, like at the north of Israel, and also I think in a lot of university. And it's a very important thing to do because, you know, at the movie earlier, we saw that the mentally ill is the story of everyone. It's not just the story of one person. And I think that if we can be aware to know that student needs help, and also adult needs help, and also children needs help, so we will have the opportunity to build a better community. So in the university also we are have programs to students and to learn together how they can deal with the study and and how to cope with their difficult. So I think we can learn. Sorry, no, it's fine. Go ahead.
No, I think that another point, a very important one, is in the socialization process of the students in social work, for example. We can see more and more invitations for us as professionals to come to lectures, to explain, to talk about mental health. So it's a very good way to talk about awareness in this area, in this field. And I hope you can see that more.
And I can say that anxiety, and it's a very, very big barrier. And it's like the first time that you do something like the Zoom in the COVID, it's so overwhelmed and so hard to do. And everybody were anxiety of things that happened with the Zoom. And after a couple of times that you're doing it and you see that you're alive, you don't have any anxiety. So anxiety can take you away from doing anything, like the normal thing that you could do, and stop it from you. And after a while, if you have a support, it's disappears. So it's confused to understand that you need to help people in specific time, and maybe not all the time, just when they need it. And I think beginning of services, beginning of learning, of working, it's really a specific time that need to be support.
Thank you, Leon. Hila Hadas, I want to turn to you for comments, but also to conclude some points from the event.
Actually, it was I was listening very carefully and read the responses on the chat, and there were few that were talking about lack of resources and lack of money in order to build professional services. And I want to mention that 43 years ago in Israel, there was no Enosh, and there was nothing about community-based mental health rehabilitation services. So there was a lot of dreams, a lot of need, and few courageous mothers that made a decision to put together an organization. They didn't have any resources. They didn't have the community, because the shame barrier was so enormous that it was really a tough decision to expose themselves and look for people that are in the same situation and build an organization. And if to go back to what they put together as their vision, it's the same vision that we hold today. They were talking about the importance of talking, sharing experience, and then from sharing experience and defeating the stigma. And with that, start the conversation with the government and policymakers and change the policy. Then they understood that together they can't do it. So they need to gather volunteers. They need to gather professionals that at that time were only in the, I would say, medical kind of understanding or approach. And together they build what is now the know-how, the best practice of what is rehabilitation mental health services. And they had a lot of, I would say, motivation, no resources. They created their allies, and they worked very hard. And now it seems like a very simple situation that Enosh is the Israeli mental health organization, and we have a law and we have everything. But we worked hard along those 40 years and paved the way, as I said before. So it's a lot about leadership, 43 years of leadership, different people, but leading, about how to put together resources and not leaving anyone behind. And there are many options to create a situation that would be different than what a person or a community or a state or a nation have now. So just to say that a long way, a lot of work and dreams can come through, and we can help with everything that is needed, just thinking together and showing how we worked and how we came to this point.
Thank you, Hila. That was so important. Chava. Yeah.
Yes, I'd like to close and just to say that I think what Hila said now is really encompasses really how Israel has started its social services, many by NGOs. We know that I see the comments here of many from Peru and other countries that we don't have this, we don't have the money, we don't have the resources. But as Hila said, this always starts either by one crazy person or a group of people that want to change, that want to make a change. And it's important for them to make a change. And we know this from the service for abused children and from other services. There's someone who decides that I'm gonna try and tackle this. And it might be because someone in the family has the problem, or they themselves have gone through a certain problem. And we see how many people or groups of people can get together and really make a change. And I think Enosh is just an amazing example of this. And we see the many services and how many people get assistance. Because we know social services, government services do not have the resources, and in Israel and in many other countries. So we can't wait for governments to do things, because it may not happen, and usually it does not happen. And people that have this in their heart to make a change, they are the people that will make the change. Eventually it'll go to policy, it'll go to other things, but it usually starts from either one or a small group of people. And as Hila said, so this is the example of Enosh, and it's just something that you can learn more and more about. And I think hearing Leon was just amazing. And thank you very much for giving of your experience, because I think this says more than all us professionals can say all together, and not taking away from anyone, but to hear a person from what he goes through and how he copes and how he becomes resilient. This is just amazing to hear you, and my hat goes, don't have a hat on, but my hat goes off to you. So I think we can all learn, and I want to thank our embassy in Geneva for putting Devora together for this conference, and of course our dear friends for Enosh, who do just such amazing work in Israel and abroad, and we hope that now we had 150 people on at one time on this webinar, and as we said, it's on Facebook Live, and any one of you who wants to get a copy can get a copy, and you can see it on the Facebook of the Ministry of Foreign Affairs, and I'm sure Enosh will also put it on their website. So and the various embassies, the Geneva, our embassy is also putting it on their site. So I think this was a great opening and an eye-opener for many people from many countries. And you don't have to fear, if you don't have the money and you don't have the resources, we all started, as Hila said, we all started like this. Everybody starts like this. All the organizations start like this. But you have to be a little crazy. And no, I don't mean that about the people in Enosh, of course. But in general, somebody who's crazy about the idea, and you have to really want to make a change. And I think we saw this from Leon, who wanted to make just a fantastic story. And this is life. This is life. People have to take it upon themselves and do something to change their lives. And as you said, we have to listen. Professionals have to listen. And I think that was one of the most important messages, what you said. We have to pay attention, we have to listen, we have to give credit to the people that are going through the traumatic experiences, that a lot of the things, they know what they need and know what they want. And you know, some of us think we know it all. I'm a social worker by profession, so I can say that as well. But we have to pay attention and listen. And that's something that is quite difficult to do, listening, and something we all have to hone our skills. So thank you so much for coming on. Thank you to Liron, to Hila, to Einat, Sylvia, I don't want to forget anybody, Leon, Shirit, and Liron, really, you did a fantastic job. And we thank you for working with us on this topic. It is such an important topic. And we know that, as we said, as Hila said, Israel 40 years ago was where many countries are today. And we thank Enosh for being willing to help the other countries and to being on this webinar today. So thank you so much. Liron, if you want to close, Anna, Katrina, please.
I will say thank you for the platform, and thank you to our representatives here that worked hard to show you some of our learnings.
And Hila, would you like to say anything else before we close?
Yeah, thank you so much for the opportunity and for helping us to put it together. And we wish to share our experience with anyone that wish to do so with us. Thank you.
Okay. Anna, Katrina, do you want to?
Thank you very much, Liron and Eli and everyone, because it was a fantastic experience. And Leon, for sharing your life with the public. It's something that you you can't hear it every day, and just continue to be brave and strong. And I have no words ever to describe what it's meant to you to be so brave and so, you know, inspiring, really. So thanks again to everyone, and I hope we will continue to speak about it in other languages, in different languages, because it's really the topic that we need to continue to work with. Katrina, want to say something? So thanks again to everyone, and
thank you very much. It was really very emotional. In addition, what's very helpful, it was very emotional, Leon, and thank you very much, Enosh. And I hope to see you again in other courses and webinars. Thank you.
Thank you. Toda rabba. Thank you very much.
Toda rabba. Thank you.
all the best to everyone, and just use the experience you heard about.